Hello and welcome. You have been invited to review this information because you're a healthcare practitioner. This is Dr. William Toth, and I'm your host for the next few minutes. 15 years ago, I was in your seat. I loved what I did. I focused on treating athletes, sports injuries, and neurology. I practiced for nearly 12 years up in Chicago, had an awesome career, one of 7 docs chosen to travel with the World Soccer Cup. Front page of the sports section, sat next to Oprah. I had a great career. I loved what I did, and I had no life. Now, I'm here to share with you a program that could improve your situation. The Biophotonic Scanner program is designed to add 30 to 100 grand to your bottom line without increasing your staff or hours. That is a bold statement, and we're going to show you how. Now, we do know it's tough out there. I don't really think I have to dwell on this. Everybody is talking about lowered reimbursements and fees being cut and layoffs and unreliable staff and so on and so forth. So let's not dwell on this. Let's focus more on what you're doing about it. Now, here's what a lot of people do. They wait until they have a wake-up call, until they get bought out by a hospital or some kind of chain or some kind of corporation, or they can't afford to stay in practice anymore, or they have a birth, a death, a divorce, a car accident, or something that makes them shift and take action. And the reality is that you can take action at any point, yes, even today. Now, we know your peers are looking to do something. The #1 most read article on Medscape in 2013 was 12 ways to earn extra income from your medical activities. Unfortunately, every single one of the ways listed in this article requires the healthcare provider's time, which you already don't have enough of for most part. And so that was one of the downfalls of this article. It was some great suggestions, but every single one of them required your time, and especially your time out of the office. And that's just not going to work. Now, what if your life and your lifestyle was just as important as your patients? And what if you could have a bigger impact with less sacrifice? That's what we're going to talk about next. The Biophotonic Scanner program is designed to generate better clinical outcomes. And what if you were to generate more referrals because of that? And what if you were to generate more income? That's the point, right? Now, the origins of Pharmanex. Pharmanex was started by Dr. Joseph Chang and his partner, Dr. Michael Chang, no relation. They had been working in the pharmaceutical industry for 15 years. One of them had a family member get ill, and they looked at the nutrition world back in the 90s, and it was the wild, wild west. You could slap a label on a bottle and call it whatever you wanted. You could cut up your front lawn and stick it in a bottle and say it did whatever you wanted to say it did. And that just didn't fly for these gentlemen. So they started a company called Pharmanex, and they brought the pharmaceutical success production process to the nutritional world for the first time. And they achieved nearly 50 million a year in sales. They had their products in Rite Aids and Walgreens and CVS's around the world, 38,000 locations. They're doing about 50 million a year. And they were purchased by NSE in 1998, the same year, the same month that I started with this company, October 98. And the company told them to take all their products off of all the shelves in December of 98, and they did. And then January of 99, the first month that we owned the company, we sold more of their products by word of mouth, 4 times more of their products than they had sold in the previous 12 months in 38,000 locations. Dr. Chang is also famous for a book that he wrote in 2011 called The Aging Myth. I highly recommend that you get that. It explains genetically the aging process and in layman's terms, and it also gives you all the science in the background as well. Now, the Pharmanex difference, we have 75 full-time PhD level scientists on staff. That's a key distinction. We pay these folks about $10 million a year. They're from all different disciplines, working on the biggest problems of aging, which are getting ugly, getting tired, getting fat, and getting broke. We have about 150 scientific associations globally, affiliations with leading universities such as UCLA, Stanford, and so forth. And of course, the core of what we're doing is the success quality process. It's a pharmaceutical approach to the formulation of nutritional supplements. That's to sum it up. Now, who's behind this is a company called Nu Skin. You might know Nu Skin. They've been in business for 30 years. They're in 53 countries. And about 3.5, 4 years ago, they shifted their focus from skincare and nutritionals to anti-aging. And since then, the company has dramatically taken off in terms of growth and recognition. Forbes magazine calls us number 5 out of the top 100 most trustworthy companies in America. The American Business Awards, we've won 4 years in a row for innovation, and that's the name of the game, innovation. And the symbol is NUS. We're publicly traded, so everything we share in this presentation is a matter of public record, and it's 30 years of stability and success that's behind this project. Now, Nu Skin owns the assets that you see here. They own Pharmanex. They purchased Pharmanex, as I already said, back in October '98. They own Nox Technologies. That company has the patents on a molecule that's going to change skincare next year, 2015. LifeGen we purchased. We purchased LifeGen simply because they have the world's largest genetic database as it relates to anti-aging. And owning them is a key business distinction because that means no other company can take their information and make a competitive product. You might remember LifeGen, they were one of the companies that helped unravel the human genome back in 2003. And more importantly, in 2008, they figured out how to put our human genes on a computer chip. And more importantly, to what we're talking about today, is they figured out how to test products against the genes without having to sacrifice animals. And we get an answer in hours or minutes. And of course, the biophotonic scanner is what we're here to talk about. Now, the bottom line here, this company is going after the sources of aging. Again, the biggest complaints of aging are getting ugly, tired, fat, and broke, and we're going after it from the source, which is basically, at this point in time in science, genetics, and especially the science of epigenetics. That is the core of what we're doing on a daily basis and what we're infusing into our product lines. Now, we measure what we do. These are called heat maps. That's where you're looking at gene expression on a computer chip. You can see the one on your right is youthful. The one in the middle is old, and the one on the right is the old expression with a product we created called Vitality, and what you see there is a 92% reset to the youthful state. In other words, we turned back Grandpa's internal clock 50 years. Now, maybe you're only 49 years old, you don't want to go back 50, that might be awkward. But how about if you could have the energy you had when you were a youngster? Because that's what we're talking about. Now, the Pharmanex biophotonic scanner was developed at the University of Utah. And those are the same folks that invented the artificial heart. Those folks were looking for a way to measure antioxidants in the back of the human eye. They discovered that human beings don't like having a needle stuck back there for a biopsy. They looked around the world and they found this technology called Ramon Spectroscopy, which has since won 2 Nobel Prizes in physics. And they made this machine that initially was as big as a room. And you sat in front of it like you do and put your face in a thing like you do at the driver's license facility, and you got a measurement. Now, when we saw what they had done, we purchased exclusive rights to this device for 20 years. It's the only way to measure antioxidants in living human tissue in real time. You can take a punch biopsy, but then the tissue's dead. So it's the only way to measure antioxidants in living human tissue in real time, and it provides support for clinical outcomes, generating referrals, and of course, income. Now, Raman spectroscopy has been around for quite some time. It's won 2 Nobel Prizes in physics. It's a well-documented. In fact, there are over 50 peer-reviewed, full-length clinical articles regarding the scanner and the use of the scanner. And those can be made available to you when you're ready to read all that. What do we measure? We measure specifically carotenoids in the skin, which is the site of action. And research has shown that carotenoids predict the overall body of antioxidants, your total antioxidant status. Even though carotenoids are just one form of antioxidant, they happen to be the largest form of antioxidants. So you can extrapolate that it represents the person's total antioxidant status. And again, there's over 50 peer-reviewed, full-length clinical articles on these topics. Again, it's an extremely useful biomarker. This is just from 2013. Essentially, it's one of the most important biomarkers you can have regarding your health. That and your body fat percentage are probably the 2 most important biomarkers you can have. Now, again, it's reproducible, over 50 peer-reviewed clinical, full-length clinical articles on these topics that can be made available to you when you're ready. So what are we talking about? Oxidative stress. It's everywhere. You know, right now you're sitting in a room, the chair you're sitting on, the carpet you're sitting on top of, that's all emitting fumes and toxins. They're all petroleum-based products, and they're all degrading while you're sitting there. They're all creating free radical damage to your body. Then you're going to leave your office today, you're going to go sit in your car, and You know, maybe it's 100 degrees outside or 130 degrees in your car, and you're going to turn on your air conditioning and take a deep breath of all those free radicals that have been cooking in that car while you were at work. And then you're going to go home and you're going to be impatient and in a big hurry to eat, and you're going to stand in front of the microwave watching it turn round and round. You're going to blast yourself with free radicals there. Of course, cell phones and cell phone damage, well documented as well, although a little bit controversial, right? And so we're bombarded by toxins every day, all day. And that's in addition to the ones you produce just by being alive. And then, of course, the emotional stress of healthcare reform and so on and so forth. And so all of this is creating free radical damage, and there's not a whole lot you can do about it. What you can do is protect your body. You can't change your surroundings. This is the world we live in today, okay? Petroleum products are all around us every day, all day. The world of plastics. Thank you very much. But you can do something about the defense mechanisms in your body. Now go do your homework. Just about any disease condition that you can name or that you see in your practice, you put that in PubMed, which is the largest database in the world, along with the words oxidative stress, and you're going to find a body of research relating to exactly to what you do. Now, maybe you don't have time to do this. Maybe you can get your staff to do it for you, but do your homework. Oxidative stress is a huge issue and a huge area of research for many years now. Now, we also know that in the defense of your body, you are what you eat. Antioxidants from the food you consume are incorporated into your cells. And the best way to get your antioxidants, of course, is from the food you eat. The challenge with that is this. People don't eat what they're supposed to. The federal government recommends 2 to 3 servings. Dr. Oz recommends 9 to 15. Dr. Cooper up in Dallas recommends 5 is fine, 9 is divine. But basically, most people don't eat what they're supposed to. And even if they did, the challenge with today's food supply is this. When you and I were growing up, it was an apple a day keeps the doctor away. Today, it's 20 apples a day keeps the doctor away. The food we eat today does not have the nutritional content of the food we ate when we were kids. And so basically you need to eat more of it, which again, most people aren't going to do. That basically means you have to supplement. Now, this is a mindset shift in medicine that started back in 2002. The American Medical Association finally relented to about 100 years of pressure from other practitioners, and they recommend that all adults take a multivitamin daily. But then how do you know it's working? That's where the scanner comes in. Now, the antioxidant shift. Antioxidants have been a huge area of research as well. The European Journal of Nutrition, the biggest study of its kind, an 11-year study of 23,000 people. And what they found, they were comparing a regular one-a-day CVS multi-mineral multivitamin, just a one-a-day type tablet, versus a product like our Life Pack, which has over 60 antioxidants added to it. And what they found after 11 years and 23,000 people, that if you took a supplement like our Life Pack, you were 48% less likely to die from cancer and 42% less likely to die from all causes. Now, don't take my word for it. Go out there and do your homework. There's lots of data out there. Take any disease condition you can name or that you might see in your facility, put the word antioxidants with that condition into PubMed, and you're going to find a body of research. And overwhelmingly, more antioxidants is better. Now, we have our own data. We have scanned over 18.5 million people as of February 2014, and we can correlate directly somebody's lifestyle with the amount of fruits and vegetables, whether or not they're a smoker, whether or not they're overweight, whether or not they're taking our products, and so on and so forth. It's the largest health database of its kind, so that means we own 2 of the world's largest health databases, the one from LifeGen and the one that we've created on our own. And so you can see the mean score there. You're going to compare that to what you do or what you see in your practice, in your facility, as you implement the scanner. Again, LifePak Nano is the core of what we have, along with G3 and Vitality. We affectionately call this the Holy Trinity, and it is the #1 recommendation is that package right there. And the great thing is you can measure. The scanner is a measurement tool. Dr. Oz called it the ultimate lie detector test. It doesn't care what brand somebody is on. It's just going to take a measurement, and you're going to be able to determine if that particular product is raising that person's antioxidant score or not. And so we have the only performance guarantee in the marketplace. That means someone will get scanned, they go on our product for 60 days. At the end of 60 days, if they don't raise their score, they get all their money back. So let's get back to business. You know, as your fees are cut, or maybe they stay the same, your overhead's going to go up, what are you going to do? You're going to pinch pennies? You're probably already doing that. You're going to cut down the amount of time you give per patient? Probably already doing that. Work longer hours? Probably doing that. How about the work till you drop retirement plan? You know, I thought I would work until I was be in practice until I was 80, 90 years old, but life threw me a curveball in the form of a daughter, and I decided that being with my children was more important than the titles and the degrees and so forth. And then, of course, you know, stress out, burn out, and generally miss out. Or can you be proactive? It's up to you. The scanner program, again, you're going to generate better clinical outcomes, referrals, income, and it's a possible exit strategy. If you want to use it as an exit strategy, I can show you exactly how. I've been there and I've done that. Your initial startup, about $3,500. Now, there's a lease. Guess what? The lease is free. Add 6 new patients to our product line in any calendar month, and you're going to get the lease payment waived. Practitioners that work the program and actually use the program rarely make a lease payment. And the great thing about the lease, folks, if you decide this program isn't right for you or your office, then guess what? Send it back, and all you're going to forfeit is your $500 deposit. You're not going to be on the hook for the remainder of the lease like you would be with a car or something else. And so that's a great thing about our company. What's in the package? Products that you're going to sell at your initial scanning event so that you can recoup your investment. And you're going to be getting these products at wholesale. You're going to sell them at retail. And of course, you also see here 600 scan cards. Remember that. We're going to come back to that in a minute. But again, it's products you're going to sell at your initial event so you can recoup your investment. Now, what's on the table for you? Well, scanning fee, the company recommends the minimum you charge is $20. There are some doctors in the greater Houston area that charge more. We don't recommend that because we live in an internet-connected world and people put out there on the buzz that what they paid for their scan. So if you're charging more than $20, there's a potential you might aggravate some of your patients. And if you're charging less, you might not see the value in the return. You must charge something. No charge equals no perceived value. It's about the same as a free consultation. You know what that generally gets you. Now, scanning revenue. Now, we assume, based on 18.5 million scans, what we see the best practices, we're assuming a 5-day work week. We're assuming 2 to 3 patients being scanned per day, 50 scans per month. That's $1,000 a month in your pocket. Okay. Now, $12,000 a year. That's about 3.5 times your initial investment. Can't do that with an X-ray machine, can you? And so here you have a program that generates cash. It's designed to generate 30 to 100 grand to your bottom line without increasing your staff or hours. It's designed to be a staff-driven program, and we're going to show you how to implement it. Now, there's product revenue. Now, when you're recommending our products, you know, we know that typical purchase is going to be about $100, and you see some sales volume there. Assuming you meet the requirements for the free scanner lease, you've got $13,000 from product. That's $25,000 in your first year. That's not including the retail markups that you have if you're just buying the product at wholesale and selling at retail, which is what most practitioners do. 99% of the practitioners will use this program as a straight wholesale retail play, and it works. On average, about 10% of your patients will decide for themselves to increase their antioxidant score, possibly improve their health by using our products. And so you work the numbers for yourself. What are the numbers for your facility? What are the numbers for your practice? Is it just 2 to 3 patients a day? How about all those patient files that you have sitting back in your office? You could use your staff to reactivate some of those files. The conversation is very simple. Let me show you. Again, the program's success, the practitioner uses the products, increase their own score, recommends the products, patients are charged for the first scan, staff participates as an incentivized. Now, what do I mean by all that? Well, the conversation's real simple. Gee, Mrs. Jones, your score's really low today. How about if you use the same products that myself and my staff and my family use to raise our score, and let's see how high we can raise your score. That's a very easy conversation to have. Again, you must charge for the scan. No charge, no perceived value. And the patients are only paying for the first scan. Their rescans are paid for by the company. The company is going to pay you to do the rescan. The patient is going to pay zip, nada. And then staff participation, what a lot of doctors do is they take and they purchase the initial month or two of products for their staff, so their staff is on the products and has an experience as well. And then they also take that $20 copay or that $20 fee from the scan and they put it into a pool. And they divide it amongst the staff based upon how many people they refer in to be scanned. That's one way to do it. You might be creative and think of other ways as well. Implement it. The scanner is very simple. You might use it as part of your initial patient or reactivation exam. You could have the conversation with people. Gee, Mrs. Jones, you've seen it on Dr. Oz, and now we have one in our office. Why don't you come on in and get scanned? Maybe you have the Meet the Doctor or nutritional education nights or back to school screenings or schools ending screenings, athletic performance programs, lifestyle programs, weight loss programs, special needs programs, any number of ways to implement the scanner as a measurement tool into your office, into your practice. So what do you want to do? Be proactive. Purchase the healthcare practitioner starter package. Schedule the follow-up so that the person that's sharing this information with you can come to your office and show your staff how to set it up and how to run it, how to place orders. And the person that's sharing this with you is also going to help you run your first 1, 2, 10 scanning events so that you're up and running and profitable as soon as possible. It's been a pleasure spending this time with you. Have a very blessed day.